Hello, I'm Mark Rickenbach. I'm a visiting professor at Winchester University and a general practitioner, and I'd like to talk to you about frailty care. And we've recently set up a frailty or wellbeing clinic locally, and there were some components that seemed to be particularly important. And as a general practitioner, I have perhaps 10 or perhaps 15-minute appointments, but actually the face-to-face time I have is quite limited. Might be 7 minutes to sort out a complex medical problem for somebody who may be quite frail. So what I need is a team around me who can help me to address the healthcare concerns of somebody who is frail and often older. And for that we've set up a Frailty Clinic. That Frailty Clinic consists of an assessment over about an hour by somebody who's experienced in frailty healthcare. Maybe a consultant nurse or a healthcare practitioner or a consultant physician. And that person can work through the different issues that are there. The key here is using the primary healthcare records or whatever records are available to plan ahead and think about what the issues are faced by that individual. And those issues need to be ordered with a duration of symptoms and some sort of initial action plan. It doesn't have to be all done in one go, but some sort of initial action plan. Now that's one part of a comprehensive assessment. But the other important bit we've discovered in frailty or wellbeing clinics is the social care input. Because as a general practitioner, we have not got the time or facilities to access the social care facilities. And having a 1 hour comprehensive assessment attached to a half-hour social care assessment can actually make a big difference to that patient. And the social care issues we might look at would be the environment of the house, access to the house, facilities around the house that might help them day to day. You might look at allowances and benefits that would help them financially to keep them more independent on their own. And you'd also look at supporting the carer. And that carer may be a relative or it may be a carer organisation. But it's about a team, the individual patient and the carers who are helping them. And it's very important, we found in a frailty clinic, to bring along the carers and relatives so that they can actually see what the issues are, agree of course beforehand to share in confidence, and can then help plan together with that individual patient a way forward. And we found quite remarkable changes in support for that individual once the carers, relatives and patients have worked through each individual problem and can plan what to do next. So, the key components of a frailty clinic or wellbeing clinic are an assessment with some time using the records that exist, often primary care records which are really comprehensive, putting together an action plan listing all the issues, including a social care review and including the carers or relatives. And those are the key combinations that make a big difference when you're looking at providing care for frail, older or younger people. And when I'm talking about frailty, I'm talking about somebody who has mobility issues, has some needs for a carer, and often may have memory impairment or cognitive issues. So thank you very much for listening. I hope that was of help.